Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, doctor. Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Okay. Basically, ma'am, seizure actually, for understand seizure, we have to understand what is brain. Brain is basically is a powerhouse of our body. Lot of electrical networks are there in the brain, and in these networks, the electrical signals run. Whenever there is storm in these electrical signal, like short circuit in electrical signal, then only seizure occurs. So basically, seizure is misfiring of these electrical signals.
What is epilepsy?
Basically, seizure is single event in which patient has jerky movement, unconsciousness. But this is not epilepsy. Epilepsy is basically when a person has recurrent seizures without any obvious reason, like fever, infection. Then in that condition, we call it epilepsy.
What are the different types of seizures and do they affect people differently?
Yes, there are many types of epilepsy. Focal epilepsy, generalized epilepsy. In focal epilepsy, there are multiple types like simple partial seizures, complex partial seizures. In focal seizures, or we say partial seizure, there is abnormal electrical activity in a particular part of brain. But in generalized epilepsy, there is abnormal electrical discharges in whole of the brain.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
No, not always. In all cases, we cannot find exact cause of the epilepsy. But in more than 50% cases, there is cause can be determined. It may be some structural pathology in the brain. It can be some metabolic insult in the body, or it may be some genetic cause.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Basically, symptoms and signs of epilepsy depend upon the type of epilepsy from which a person is suffering. Suppose if a person is suffering from generalized epilepsy, he will have sudden onset loss of consciousness, sudden onset jerking of the body, frothing from mouth, clenching of teeth, sudden head turning to one side, incontinence, sometimes vigorous body movements, and this loss of consciousness, this tonic-clonic jerky movements persist for few minutes and followed by loss of persistence of unconsciousness for some time. In focal epilepsy, patient may have focal movement, matlab, partial movement of some body part, abnormal sensation in some body part, or some abnormal feeling like that.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Basically, for a long time, epilepsy has lot of myths. In past time, people don't take epilepsy as a neurological disorder. They used to consider it as some upri chakkar. So they don't consider it as a medical condition, neurological condition. And in villages, they don't go to a doctor and they take treatment from Babas, Zola, Ojas, because they don't consider it as a medical condition. So that's why people who are suffering from epilepsy, they go and don't get right treatment on the right time. That's why their suffering keeps on increasing.
How does this stigma affect people with epilepsy?
If people are having myths about epilepsy, they will not go to qualified doctor. They will be misguided. They will take local treatment, which is not proper evidence based treatment, and that's why their seizures are not controlled. day-to-day activities are affected, and with time their mm, activities of daily living are affected. And when a person is affected, whole family, whole society is affected.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Definitely there are a lot of trigger, there are a lot of factor which can trigger epileptic fit, like sleep deprivation, hunger. A patient is not taking his meal at times, sleep deprivation, hunger, bright light, flashes of lights, stress, some infection, fever. These are common trigger which can precipitate a epileptic fit.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Yes, a person should take his anti-epileptic medicines regularly. First, most important thing, if a person is suffering from epilepsy, he should take his medicine regularly at regular time. Second one is avoid sleep deprivation. Patient who is suffering from epilepsy should take normal sleep. He should maintain his regular sleep hygiene. Third one is he should not skip his meals. He should avoid stress. He should avoid consuming alcohols and any other abuse material. These are some common lifestyle modification which a person of epilepsy should adhere.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yeah, to prevent injuries during seizure, family members can keep all the sharp objects in room or house away from the patient. They can put soft carpets on the floor to avoid injuries when a patient have seizure and fall. And they can avoid cooking over stove and gas burner to avoid burning during seizure. And patient should avoid stairs without any without supervision of any family member. These are some common things which we a person can avoid.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
No, that's all. I want to say that if a person is suffering from some type of epilepsy, he should definitely go to a qualified doctor. He should get proper consultation from a doctor, because in almost 70% cases, if epilepsy is diagnosed at right time, almost 70% can live their life without any seizure, and they can have their life without any problem.
Thank you, doctor. And thank you to our listeners. Until next time, take care and stay informed.